A new report from the CDC shows that there's been a steep drop in children getting vaccines. Doctors say that could be a big problem, especially when it comes time for kids to go back to school. Stetson Miller tells us more about why health experts are pushing parents to get their kids vaccinated.
1, 2, 3, go. You're good.
While the nation grapples with the coronavirus pandemic, pediatricians are worried about protecting children from other diseases because many are missing vaccination appointments.
The Centers for Disease Control and Prevention put out a report last week that showed a pretty dramatic drop in those visits for vaccines.
Johns Hopkins pediatrician Dr. Barry Solomon says staying up to date on vaccinations is critical, especially now.
These are essential vaccines to protect kids from viruses and bacteria that we know are in our community.
An example is the measles vaccine, which kids need around age 1 and again around age 4. Without it, another public health problem could happen.
If we back down on that essential part of our healthcare, then we are putting ourselves at risk for a whole other outbreak, especially once the schools open.
Dr. Edith Dietz is also concerned about an influx of children in need of vaccinations before schools reopen.
The public schools are mandated to ensure that kids have a minimum of vaccines.
While Dr. Dietz says she understands many parents are concerned about COVID-19, she points out pediatricians have taken extra precautions.
Some practices are doing temperature checks, wearing masks just the way that we wear at the grocery store.
Doctors are working with parents to reassure them that they can safely vaccinate their children during this crisis.
Probably one of the most important things a parent can do for their kids right now.
And for a full list of vaccine requirements for children, head to our website, WJZ.com. In Federal Hill, Stetson Miller for WJZ.